All right, so you've just had your buccal fat removal procedure with us. So I'm just going to go over some of those post-op instructions. Swelling is going to be normal for those first 24 to 36 hours. You'll notice that's kind of when the swelling peaks. You may also have some swelling in the jawline. This is normal. To be concerned about would be one-sided swelling. So anything like that, we would ask you to notify us. To help with the swelling, we're going to give you some ice packs. So with the ice packs, just wrapping them in a cloth or paper towel just to make sure there's some sort of barrier between the ice pack and your skin. And icing for 15 minutes on, 30 minutes off. You can do this for the first 1 to 3 days as needed to help with that swelling. As well, to help with swelling, you can sleep elevated with a few pillows behind your back around 30 to 45 degree angle. We suggest doing this for the first week as well, which can help with the swelling. You may notice some discoloration of your cheeks. This is normal as well. It's not unusual. It should subside in the first 1 to 2 weeks after the procedure. If you do feel like it's more discolored on one side than the other, just give us a call and we can assess further from there. You're going to have some sutures on the inside of your cheek, so 1 stitch on each side. These are dissolvable. They're not something that will be removed. Just to make sure to keep the wound clean, we ask that you do a saline salt rinse 3 to 4 times a day. And with that as well, so for your diet following your procedure, making sure that you're avoiding any crunchy foods, difficult things to chew like steak, tortilla chips, that kind of thing. Softer foods like a chicken stew, mashed potatoes, yogurts, those kinds of things are best to stick with for the first week. To help with the healing of your cheeks, just make sure you're avoiding any sort of contact with the cheeks, any banging of them, resting on them for the first week, as well to avoid any heavy lifting for that first week. So for your follow-up appointment, you'll have a follow-up within the first 7 to 10 days after your procedure. We'll take a look, make sure everything is looking okay and healing properly. But as I had mentioned, if there is anything of concern, such as the one-sided swelling more than the other, or any other possible concerns you may have, you can always reach out to us. So during regular hours for non-emergencies, you can contact our front desk. Anything in the evenings or on the weekends, please reach out to the number that's going to be on the post-op care sheet that we give you. That's going to be our provider to reach after hours in the evenings and on the weekends. And then as well, if you have to go to the hospital for any sort of emergency not related to your procedure with us, call 911, go to an emergency room, and then just whenever you get a chance, give the clinic a call and notify us, just so we can be up to date on your health as well. All right, so that's pretty much it for your post-op care instructions for buccal fat. Thanks for choosing us at Visage, and happy healing.